Hi, everyone, and welcome to Lyfebulb Live. Today's focus is recovery tools, and my name is Karin Hehenberger. I'm the CEO and founder of Lyfebulb, and I'm here with Annmarie Giannino, who is our community director, but also someone who's living with substance use disorder. So welcome, Annmarie.
Thank you. It's funny to be in the opposite position here, but I'm really excited to just talk. And I think something that's really, really important for people to understand that recovery isn't just about alcohol or drugs. It's about eating. It's about self-harm. There's so many different variables to recovery when it comes to addiction. And I think that this is a conversation that needs to be had, especially in our world right now.
Absolutely. And do you think we should welcome our second guest?
Yes, let's bring him on.
Let's bring on Avery.
Oh. He's coming. We're joking because Avery's internet is terrible. So is mine apparently. So everyone's using the internet right now. We're just going to go with the flow. But he is on. He may not show his face immediately right away, but we can hear him. So
welcome, Avery Nix. And today's topic is recovery tools. And as Annmarie so well said, recovery can be from many different things. And in the case of both of you, actually, it has to do with substance use disorder. But the two of you have handled it quite differently. And I do think it's important to put it in today's context, the fact that we're living through a pandemic. And as a company, Lyfebulb, we entered into this space last year as it was a new space for us, but it was so important because of all the different chronic diseases that we're involved in. You know, substance use disorder was one that got very affected by the pandemic. How did you feel that it affected you personally in your stage of the kind of journey with this problem? If we start with Avery.
Yeah, Karin, and thanks again so much for having me. Just truly grateful to be a part of this and really just part of the conversation. Yeah, I think I think for me specifically and kind of my community and my recovery community, kind of what that looked like for me is, it was very different. I mean, listen, I couldn't imagine, right? Like coming into COVID-19 with like 20 days sober. You know what I'm saying? Or like, yeah. A newcomer in, a 12-step program or, fresh out of detox. It's been interesting, right? Because there's so many, thank God for Zoom, right? And keeping us kind of connected as far as the recovery community goes, but definitely has affected a lot of us in our community, no doubt about it.
Yeah, but you stayed connected. You stayed connected with, sorry, Annmarie, I just want to build on the connection and then ask you how you dealt with that, Annmarie. But the connection that you had, you were able to keep through the internet, or how did that work?
Yeah, it was, through the internet for sure. Even just like picking up the phone, right? Like, I think, even before the pandemic, like I know for me, like in recovery and for a lot of other people, sometimes it's hard, right? Like when you're going through struggles or life happens, it's hard to pick up the phone and reach out for help. It's hard to get back to basics, right? Like in regards to how we managed to get sober. And for me, it was like, well, I can pick up the phone. I can make that call. I can hit that Zoom meeting at 6 o'clock and be a part of my fellowship, or I can jump on this webinar, right? Or what have you, whatever I can do to kind of feed my brain and feel whole and stay connected. I think that's definitely been key, no doubt.
Yeah, I kind of had the opposite effect to it because I feel like with recovery, it's all about control. And I feel like I was out of control because you couldn't, not that I went anywhere to begin with, but you hold your going, and the isolation of having to stay in one place was hard. And for me, I love going to meetings where I'm around people and I can engage with other people in a physical presence. I know for the community that I am in locally, you miss seeing people if they're taking care of themselves. You don't see, you only see me from the waist up. You don't know if I've taken a shower today, if I've eaten today. When you have to go into a meeting, you got to shower. You got to make sure that you are presentable. You maybe make sure you eat because you don't want to pass out there. So I think we lost a lot of that. However, in talking to a lot of our recovery groups locally, we found the opposite happen, because it's really hard to walk into a recovery meeting because the sign's there, you're walking into it, you're admitting that there's an issue. On a Zoom meeting, you still do have a little anonymity. It's not so much you're walking into something. So I see both sides of it. But the thing that got me the hardest, and Avery, you and I were discussing this a little while ago, is seeing everybody posting that they're drinking at 3:00. It's 5:00 somewhere. What cocktails are you making? Let's have cocktail Zoom. And I'm here trying really hard to not, pound a bottle of bourbon so that I can get through some pain that I'm feeling. And that was really hard. It was truly hard, that part of it, seeing everybody drinking and eating and everything that I lose control with.
So Annmarie, you are still kind of drinking in moderation, right? I mean, you're not in total abstinence right now. How do you feel that was? I mean, that must have been triggering in some
Yes,
ways.
it 100% was. And I mean, it's easy to have, for me, where I am, I can have 1 or 2 glasses and be completely fine. But once I get past that, I know my breaking point. I know exactly where it is. I know when I need to stop. But COVID changed that. You weren't in a bar.
What kind of tools did you use during the past year or now even?
Well, honestly, it's support from friends. And Avery, you were saying how picking up a phone, for me, it was just texting my friend, hey, I'm feeling that urge. I feel the craving. Or I would text an emoji. I have a great group of friends that we're emoji texters. And we know that if we send an emoji to each other, that's us asking for some help and just a little bit of guidance. And it was, why do you feel like you want to have it continue? Why do you want to go past that point? And, we are working with a product called Vervita right now, and it's all CBD based. It is all about cognitive behavioral therapy. It is not so much about, taking a supplement or, going to therapy. It's about trying to figure out your mindset and why you are in that space right now. Mm-hmm. And being mindful is huge, because it's really easy to go beyond that. So being in the present moment and giving me great tips. I mean, the tips that I get through the app is incredible. It's about checking in with yourself, reminding you that you don't have to have a drink today. You don't have to. What do you need to supplement that? There's something else that you're missing. And that's so true. It's so true.
It's more about the whole life, not just about your drinking life.
Absolutely. Right? Absolutely. Mm-hmm. And, the thing that is so great with that is, Avery, you and I were discussing this, Karin, nobody wakes up and says, I think today I'm going to be an addict. Out of all the things I'm going to do today, I'm going to start right now and be an addict today. It is an illness. It is an illness. And there's reasons why you get to that point. There's trauma, there's pain, there's, depression. All of that feeds into it. That's what gets you to that point. And for me, it was about numbing pain. I just wanted to forget. I wanted my brain to shut off for a little bit. And being able to check in with myself for a whole being and, understand why I'm getting to that point is really big, because you got to know your triggers if you're going to be in recovery.
Mm-hmm. What about you, Avery? How because for you it's not about moderation. For you are totally without any substance use right now.
Yeah, it's interesting, and a lot of things came to mind as Annmarie was sharing, and the abstinence or where how people can moderate, or really any of that, I don't even really think about it that much. It's just kind of like a deep down, like, internal, like, feeling, like I just know that, like, abstinence, right, is part of my solution in regards to recovery and having recovery for myself. I was thinking about the pandemic and when it really started hitting, the U.S. and I think it, and I can speak for a lot of people on this, because I spoke to a lot of people around it too. But for me, it really forced me to, even though I could get connected, right, like through Zoom and through other people, and like stay close to my program and the people that helped me get sober, it really forced me to, like, be with myself, and like forced me to really kind of take a look at the, like, what's on the inside. And I promise you, in today's world and in this society, we live in a world full of distractions. So to think that like I had to sit with myself for a period of time, that was kind of scary, and honestly, there was a ton of stuff that came up for me in 2020. That's still bleeding over, but it's all like great stuff. I'm talking like that like gut wrenching growth, that like, ugh, like I know I'm grinding in my spiritual journey of recovery, because I'm humbled every step of the way, and continue to be. It's not something that just I had like one moment of pain and everything tends to go away and I'm just happy, joyous, and free, or anything like that. It's more of just this constant like learning that I'm a human being. That's what 2020 has been for me, for sure.
So this is a question to both of you, because this is what I admire most in people when you are on this part of the journey, really, is that the understanding that this doesn't go away. I mean, I suffer from somatic disease, and I know it's never going to go away, but it's kind of different. It's treated with pills or injections and surgeries, but it's still, I know it's not going to go away, and it's really hard for me to realize that. But something like this, where you're exposed to it all the time, and other people are using some of these substances as pleasure, and it's never going to go away. It's a really tough acknowledgement to yourself, and that you gotta have to live with yourself, and it never goes away. But you still have to find a way to be happy and to enjoy. I really admire your grind, which you described so well.
So Karin, to your point, I have been at, parties, gatherings, whatever, and I'm an outgoing person, and I'm silly and I'm ridiculous, and I sing songs in public. Like, that's just who I am. I don't need alcohol to do any of that. But I've had people say to me, "Oh my gosh, she's so drunk. What is wrong with her?" And I'm like, I'm not drunk. This is just who I am. But what it's done is it's made me self-conscious of who I am. Like, it's really made me retract. And I like that part of me that's ridiculous and silly. But the other part to it is when you tell people, they're like, "Oh, come on, just have one more." And I say, I can't have one more. I cannot have one more, because one more isn't just one more to me. They don't understand it, and they push and push and push. And it's not like it's peer pressure. It's because they may not realize it, but they probably have an issue with alcohol themselves, or drugs, whatever it is, because they're pushing so hard for this person to have a drink. And I've been out where people have been like, "Oh, just have a few drinks. How are you going to have fun if you don't have a few drinks?" I'm like, I don't need that to have fun. And it goes to what Avery, what you were saying about being with yourself. I mean, I've learned a lot about myself in this past almost 2 years. And one of them is to I am. I can't falter from that, because the minute I try to put that mask on is when I turn to a substance immediately.
Mm-hmm.
So hiding, it's a way of hiding. It's a way of losing control. But, being in control all the time is really tough. It takes a lot of energy to constantly be in control. I know it, because, if someone who's with type 1 diabetes, you have to be in control every minute of the day. And it takes effort. And in some areas of your life, when you are so focused on control, you got to let go a little bit. And, that to me is an interesting one. Where do you think you are allowing yourself to lose control now that you are not losing control when it comes to your substances?
I can't lose control with it. I won't be able to turn back.
But is there anything in your life where you're allowing yourself to lose control?
Yeah. I go to another addiction, and that's food and coffee. Like, I mean, this is Avery and I were just talking about this. I don't know a single addict that is not either addicted to sugar or caffeine or nicotine. I don't know a single one. They're one of those three they are addicted to. Mm-hmm. It's finding healthy alternatives.
Yep. So it's clearly, I mean, as Annmarie said, it's really a disease. It's something that is genetic. It's something that you're born with. And then, of course, the environment triggers, stress triggers. Not everyone who's born with it is going to have the problem. But it's clearly something we have to work on. So as a final kind of advice to everyone out there listening, and those who are listening in the future, what is the toolbox? What would you And how do you build up that toolbox? I think, Annmarie, you say it so well. Maybe you want to start.
Well, first of all, I think the bigger picture is people don't want recovery, they need it. And you need to get to that point. You can't just want to have it. You have to actually realize that you need it. And that is a big tool you need to add to your life. And I think the healthy alternatives that I just said they're imperative. You can't falter because you are having an addictive personality. There's something that you need, whether it be exercise, journaling. And again, I'm going to go back to saying the Revita product because it is giving me tools every day. It checks in with me, how I'm doing mentally, because that is where addiction comes from, is through mental pain. I mean, for me, that's where it came from. So being able to use those tools, and I repeat this all the time, using them when you're feeling really good so that when you're having a really bad moment, you can go to those tools super easy, because otherwise you won't be able to. You'll spin yourself out of control. And having a support system, I know that you said it in the beginning, Karin, about building a recovery, platform on Lyfebulb. It's not just recovery comes from illnesses. When you have an illness and you're stressed out from it, you can quickly go down a path that you didn't want to get to. So it's very intertwined in other illnesses. So I think that needed to be.
I totally agree. I
really wanted that pointed out.
No, I think that's why I was saying it's so impressive because in many other diseases you have tools that are given to you by physicians. Now we're getting there with addiction. I mean, Revita is one of those that is a prescription. It's something that you're advised to use, and there are others out there. It's a disease that needs to be taken seriously and placed alongside with other diseases. And I do think that if you can handle it, you can handle others as well. And we can learn from those who are handling addiction when we're treating MS or diabetes or cancer. So Avery, what is your toolbox, and how do you deal with the situation?
Yeah, it's so interesting. This is bringing up so much for me. There's like two sides, right? I mean, we have people, right, that are like in the grips of their disease right now, right? I mean, they are in it. They could use treatment. There's treatment out there that's not affordable. There's treatment out there that is affordable. There's people that are just unwilling to get there, right? Whether that's through intervention, through family interventions, through a friend just having a conversation with them about their drinking or using problem, right? I think for me, like, if I can focus less on myself, right, and around my needs and my wants all the time, and I'm more focused in others, right, and with other people, there seems to be this like natural, like, shield, this like shield to like, I'm not necessarily putting myself in a place where I'm either going to hurt myself or someone else, because I think my motives and my intentions are pure in regards to wanting to help people, but it also helps me to do that. So it's a bit of a paradox. And then, another thing too, and that's whether you're sober curious or, a young person trying to figure out what your life looks like, sober or not sober, or just trying to moderate, I think it's like very much threefold, right? And there's three things I know that motivate me. And if I can find balance in this stuff, I tend to be a lot more content when life happens and when life is not happening, but that doesn't make sense because life is always happening. What am I feeding my mental? What am I feeding physically, right? Like, am I exercising regularly? Am I doing the things for my physical self that's going to be helpful? And what am I doing emotionally and spiritually?
Oh, I love that.
If I can check all those boxes, right? And in the beginning, I think it's important to check boxes because this is a new suit, right? A new mask that we're trying to put on when we're learning how to be sober and we're learning how to do things in a different way than what we're used to. We have to practice certain behaviors. So if you can focus on mental, physical, spiritual, and emotional, right? And find some things that could be something as easy as like reading a spiritual book. You know what I'm saying? Finding something that's like feeding that part of you. educating yourself. You could be going back to college. You could be hitting a community college and doing like something simple as taking a Microsoft Works class. I mean, whatever it may be. And then also finding like small goals, right? If you're not working out all the time, you're not doing things, and you think like, God, going to the gym is this daunting task, because trust me, I feel that way all the time. If I can just get up and do a little something every single day, right, these little goals and stuff will start growing into big goals. And that has definitely been my kind of MO, right? Since I found recovery, it's been very much like, what am I doing to check these boxes off, and how am I going about my life to help other people at the same time?
So to me, that is a perfect conclusion, in the sense that if we can check the 3 boxes: mental, emotional, as well as physical, and if we can do that and create routines so that we make sure we tick those boxes off on a daily basis. By the way, we should all do that, independent of where we are. And then finally, which I really like, which I also think is so true, is when we start helping others. The service component of what, that's true also for all disease. When we can start looking beyond ourselves and not focusing so much on our own problems, but solving the problems for others, or at least listening to other people's problems. I think that's when we can truly recover and start taking control of our lives.
And when you're helping other people, you have to help yourself, because you can't tell them what to do when you're not doing it.
Absolutely. Perfect.
Yeah.
Well,
this was great.
Thank you so much. Thank you, Avery. And I think we have the links up here for Avery, as well as for Vita, and for some other tools. And thank you, Annmarie.
Yeah, this was great. Thank you, everyone.
Thank you, guys. Really appreciate it.
Bye.